I'm Cindy, your friendly family nurse practitioner. I'm passionate about all things health and here to break down medical topics into simple, easy to understand terms. If you enjoy our videos, make sure to follow us on Instagram, Facebook, YouTube, and TikTok. And don't forget to check out our website at pathtowellnessnp.com. Today, let's talk about a DEXA scan. Dual energy X-ray absorptiometry is a painless imaging test used to measure bone mineral density and assess the risk of osteoporosis and fractures. It is used to diagnose osteoporosis, a condition that weakens bones and increases the risk of fractures, especially in the hip, spine, and wrist. The test is quick and non-invasive, typically taking about 10 to 20 minutes, and involves lying on a table while a low-dose X-ray scans the hip and spine. DEXA screening is generally recommended for women aged 65 and older and men aged 70 and older, but it may be done earlier in individuals with risk factors such as a history of fractures, long-term steroid use, low body weight, smoking, excessive alcohol use, rheumatoid arthritis, or other conditions that affect bone health. Results are reported as a T-score, which compares bone density to that of a healthy young adult. A normal T-score is minus 1.0 or higher. Osteopenia is defined as a T-score between minus 1.0 and minus 2.5, and osteoporosis is defined as a T-score of minus 2.5 or lower. Treatment for osteopenia includes adequate calcium intake of about 1,000 to 1,200 milligrams daily, depending on age, and vitamin D supplementation of typically 800 to 1,000 international units daily. Pharmacologic therapy is usually recommended for patients with osteoporosis, T-score less than or equal to minus 2.5, or those with a history of fragility fractures. First-line medications include bisphosphonates such as alendronate or risedronate, which help slow bone loss and reduce fracture risk. These medications are taken in oral tablet form, often once weekly. Common side effects include gastrointestinal irritation, such as heartburn, nausea, abdominal pain, and esophageal irritation, and patients are advised to remain upright for at least 30 minutes after taking the medication to reduce these effects. Alternative treatments include injectable therapy such as denosumab, Prolia, which is administered once every 6 months. Common side effects of denosumab include back pain, joint pain, elevated cholesterol levels, and an increased risk of infections. Rare but serious side effects include hypocalcemia and osteonecrosis of the jaw. Lifestyle modifications are recommended for all patients and include weight-bearing and resistance exercises, adequate calcium and vitamin D intake, smoking cessation, limiting alcohol use, fall prevention strategies, and maintaining a healthy diet to support bone health.